The National Family Planning Board, NFPB, is appealing to Jamaicans to facilitate its team when they come to conduct the 2021 Reproductive Health Survey. Principal Director of the National Family Planning Board, Lovette Byfield, says information from the survey will be used to develop programs that will impact family health and population growth. She shared details with JIS think tank. Melvin Pennant tells us more.
The government began conducting the periodic survey in the 1970s. Principal Director of the National Family Planning Board, Lovette Byfield, says the research looks at the factors that impact population size and growth.
The information which will be gleaned from this survey will be used in determining program implementation and other vital issues specific to how we deal with the issues relating to reproductive health. And by reproductive health, we are not just referring to pregnancies, we're also referring to sexually transmitted infections, mortality rates, and some of those other issues. To be very specific, it provides some evidence based on SRH, or sexual and reproductive health data, that will accurately update the country on the status of total fertility, contraceptive use, the knowledge, attitude, and practice of the population towards the critical issues of family planning and sexual reproductive health. We're also looking a little at maternal and child care, infant and child mortality, and to a lesser extent, sexually transmitted infections and HIV/AIDS. This is not intended to be a prevalence survey for HIV/STIs. And we are also, for this year, including the very critical issue of gender-based violence.
She says the matter of population replacement level is being investigated in the survey as well.
There are concerns that Jamaica is joining other nations in terms of the actual, we have reached the replacement level of 2.1, and that has implications for what we promote as it relates to population growth, what would be our messages. You would all recall that some time ago we were speaking to the fact that persons should limit the number of children, but if you in fact have reached your replacement level, we need to be looking at what would we be doing in this regard, and who would we be targeting or sending these specific messages to.
Ms. Byfield says the key indicators will give information that will be used to create programs aimed at fulfilling global sustainable development goals.
We have to report based on our international obligations. We have to report on these indicators, so we have to ensure that they are in line with what has been requested of the nation and what we have signed on to through the Ministry of Foreign Affairs, so that we keep our measures constant.
The survey is being conducted by the Statistical Institute of Jamaica, Statin, on behalf of the NFPB. Ms. Byfield explains that the interviewers are trained and will have identification ID card. She is encouraging Jamaicans to cooperate with the interviewers. Melvin Pennant, PBCJ News.